So let's talk long term. Let's say that we see some areas that are opening up to greater or lesser extents. So let's hypothesize that we don't see an absolute explosion in cases, and that perhaps we get some sort of middle of the road policy where you still have new infections, you still have 1 to 2,500 people dying per day. Long term, what would you advise as an appropriate response to that going forward? If you say that the sort of lockdown we've had isn't sustainable for many months, what would you say would be a replacement for that?
Okay, so firstly, we need to move to moderated lockdown, right? So, sorry, moderated social distancing. So, reopen restaurants, reopen community gatherings, and just put in sensible social distancing measures. So, keep people 6 feet apart. I don't know if other people are noticing, but now with face masks on, people are standing closer than ever, even within grocery stores where it's very clear that people should be maintaining that 6 feet apart distance. And let kids go back to school, start eating lunches at their desks rather than congregating in cafeterias. These are sensible, cost-effective measures that can be put in place. Enhanced hygiene, that needs to be put in place. All of this just isn't for COVID-19, John, and that's what the takeaway is. This is not the last infectious disease. Might be a second wave of COVID-19, and very well, we know there's going to be another emerging infectious disease somewhere down the line. So these are just good practices to put in place that we can glean off of as we start to get a better picture of the risk landscape once we get more testing in place, right? So all of these things are improving at the same time. So what I'm advising is alongside increased testing, so we can put a face on this invisible enemy. We need to see who's immune. We need to see who's at high risk. We need to do more genetic testing because we're finding that up to 50% of the variants that can explain mild to severe symptoms of COVID-19 patients can be attributed to genetics. That's really interesting. That's from one of my alma maters, King's College London, is doing the research into that. We also need increased contact tracing. That's why South Korea did not need to lock down in the way so many of the countries in the world have had to. And then we also need to get on the vaccine bandwagon and just continue to support and to speed up safely a vaccine coming into real use for society. So if all of these things happen together, then I think it's really sensible to start thinking more moderated than severe as the way we've been living. Because again, I think it's been more net harm than good.
I'm interested. Some of the proposals that you said that could theoretically help, like contact tracing and things like that, seem very reasonable to me. What I fear is that many of the sort of people that are right now protesting against the lockdowns, talking about how it's a huge infringement of their rights and things like that, there seems to be a greater prevalence of certain types of misinformation among that group about the cause of the disease, believing that it's potentially 5G cell towers that are doing it,
Right.
about what contact tracing would mean, that is itself a massive interference in people's constitutional rights, that people like Bill Gates are trying to use this opportunity to lower the population with vaccines that'll, stop you from reproducing and things like that. So what do you think about the possibility that some things like more widespread constant testing, making the vaccine nationwide available, doing contact tracing, that some of the people pushing for an end of the lockdowns now might be very resistant to those sorts of solutions?
And I can see that. I mean, look at how scared we are as a community on COVID-19, and everybody wants that vaccine. But ultimately, by the time a vaccine comes available, I assume, I definitely will make the hypothesis that we're going to have a significant amount of the population that resists getting the vaccine, the same way we see with the seasonal flu. It's risk trade-offs, right? It's what scares people more. So does the disease scare you more, or does the alternative of the processes that would stop you from getting infected, does that scare you more? So this varies from society to society, culture to culture. Various countries you see have higher and lower risk tolerances. So the reason that places like Sweden have been able to put in more measured policies is because there's a higher just tolerance for being exposed to risk. It's not the same demand to be kept safe. And it's an understanding that we coexist with risk, and it's not up to the government necessarily to protect us from everything.
Mm-hmm.
So that there's various schools of thought around this, right? But ultimately, it's the risk trade-off. What scares you more, losing your privacy or potentially getting infected? And that's something that it's going to be interesting to see. But ultimately, what are people willing to give up to be safe?
Yeah, but it seems like we should also add on, of course, that when we're talking about risk, we're not purely talking about a risk that you choose to take for yourself. I mean, after all, I can choose not to take the vaccine. I can choose to engage, go about my regular everyday life. I could get the disease. There's a good chance I'm going to be asymptomatic. I'm young. I'm in relatively good health. I might be fine, but I could easily pass on the disease to someone that could get seriously ill or potentially die. So this is a case where it's not like, I make risky decisions with my diet all the time, but I'm not giving anyone else diabetes by doing that, right? Isn't that like, shouldn't we factor in the fact that this is a particularly infectious disease, that it spreads relatively easily?
Yeah, and so there's a bunch of factors in how we come up with the frequency and probability of this disease, how we perceive it, right? So that's risk perception versus risk reality. And I would argue that voluntary risks that people take are not as voluntary as they think. And also people's own personal problems, like whether or not you take a vaccination or a vaccine, or whether or not you take a prescription drug to prevent the onset of, let's say, high blood pressure or high cholesterol. That sounds like a personal choice, right? Mm-hmm. But ultimately, we are part of a society that is really interconnected, and individual decision making does not stay with the individual. Because if you choose not to vaccinate your children, we know now, we've been hearing about it in the news, what the ripple effects are, what the consequences of that are. If you choose not to take your medication, especially in the United States, and you end up in the hospital, then that's increased costs for those that have to now deal with the higher cost of those ending up in the hospital than had they been proactive in taking their medications in the first place. These costs are not specific to the individuals, and we are much more connected than we realize. One good example is during 9/11, post 9/11, people decided that they didn't want to be in a situation where they didn't have control, and that they were not in, that they were being involuntarily exposed to risk, like getting on a plane, right? Mm-hmm. And so instead, you saw an uptick of people driving cars. Now that's something I have control over. It's a voluntary risk. Yet the risk of getting in a car is much higher than of getting on a plane. And so that's what ends up happening is when we start thinking about things like control, catastrophic potential, familiarity, whether or not a disease impacts children or the elderly, all of these things is true for COVID-19. It triggers all the cognitive hot boxes we have in our head. And that's why we perceive higher risk associated with it than a voluntary activity or a chronic disease, because they're more familiar, because they seem like we have more control. It's a trick our brains play on us. It doesn't mean it's safer.
So I think that we might disagree on some things, but I do agree with you there. And Dr. Shweta Chakraborty, thank you so much for joining us today. We really do appreciate it.
Thanks for having me.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.